Rachel's presentation, I will be discussing the institutional organizational level change and community level change on the ban of smoking. Institutional organizational level change. Smoke-free legislation is an effective public health measure. Smoking bans in public places have the potential to influence social norms and reduce smoking behavior. Offer services that include providing nicotine replacement therapy and counseling support to help smokers quit through a possible wellness program through their place of employment. Expanding insurance coverage of proven cessation treatments in places in McCreary County, places of employment. The current smoke-free places in McCreary County are the county courthouse, the county clerk's office, and any vehicle that are owned within the county. The first industry-wide ban on smoking in the workplace. The effective implementation of the Joint Commission on Accreditation of Healthcare Organizations Standards had set up a natural experiment. U.S. hospitals were undergoing the first industry-wide ban on smoking in the workplace. Investigators soon discovered that the smoking ban established to protect the health of patients had not only transformed the environment of healthcare institutions, but had also had a marked and salutary effect on the smoking behavior and the health of hospital workers. A smoking ban policy would cut overall smoking prevalence by 10% and have the greatest impact on groups with the highest smoking rates. The Johns Hopkins smoke-free policy for hospital staff, which is the first ban. Failure to comply with the ban on smoking in a non-designated area is a critical violation of the Employee Code of Conduct, in the same category as deliberate inattention to patient care, the falsification of records, and the unauthorized possession of a deadly weapon. Disciplinary action, depending on the circumstances, will lead to suspension or immediate termination of employment. I really like that this pointed out the inattention to patient care, because honestly, if you're taking care of someone that smoking probably caused them to get there in the first place, and you're, on your smoke break or you're smoking out in the hall, that's not a very good environment to be around to get to a healthy state. Improving resources for smoking cessation. Offering free nicotine replacement therapy and efforts to reduce or replace tobacco industry sponsorship and promotions through wellness programs at places of employment. Individual counseling and/or medications to decrease the craving to smoke offered by the institutional organizational place of employment. Promoting health system changes at places of employment by adding wellness programs to place of employment. Expanding insurance coverage of proven cessation treatments. Making cessation services fully accessible to tobacco users removes cost barriers that prevent smokers from accessing cessation counseling, medications, and resources. For health insurance providers, tobacco cessation is one of the most cost-effective preventative services that can be covered, resulting in savings by reducing long-term healthcare costs related to tobacco use. It is required that non-grandfathered health insurance plans to cover at no cost to the patient preventative services that the United States Preventative Services Task Force grades with an A or B rating. Unfortunately, even though tobacco cessation is rated as an A grade preventative service and must be covered without cost sharing under the Affordable Care Act, many insurance do not fully cover cessation services at the required level. Community level change. The most effective community interventions are those in which specific strategies for promoting tobacco use cessation, preventing tobacco use initiation, and eliminating exposure to secondhand smoke that is combined with massive health communication interventions. Strong evidence proves that graphic, hard-hitting anti-tobacco ads work, and those that have a strong negative emotion perform better than those that do not. Hard-hitting media campaigns are not only effective at promoting quitting attempts, they also reduce youth initiation. Media advertisements of smoking. Smoking interventions include the ability to target specific audiences through media and social platforms such as online videos, internet, smartphone, and tablet applications. Social media platforms such as Twitter and Facebook have showed improvements in how messages are developed. To better communicate with target audiences and allow for relevant, credible messages to be shared more broadly with target audiences of the true harm of smoking. The TIPS campaign was the first ever federal-funded national media campaign aimed at reducing smoking. This was one of the biggest breakthroughs in getting into the youth initiation and current smokers to decide to quit smoking. The TIPS campaign excelled by driving 1.6 million smokers to try to quit and helping more than 100,000 to succeed. Inspired millions of non-smokers to encourage friends and family members to quit smoking. By quitting, former smokers added more than 1/3 of a million years of life to the U.S. population. How will this work for McCreary County? Just like it does everywhere else. It will eventually be unnormalized to smoke in a public place. People know that smoking is harmful, and paying even more money might make people think twice about smoking. Banning smoking from public places. Studies have shown that smoke-free laws can motivate and help tobacco users quit smoking. Using successful media and social platforms will spread awareness of the damaging consequences of smoking and secondhand smoke. These are evidence-based programs that have been shown to work, and I don't see why it wouldn't work for McCreary County. Here are my references.